Okay, so one of the biggest reasons we're getting geared up to talk to every single provider is that there's a lot of protocol changes being made right now. And it's not just random that all of these protocol changes are going on. Every single medical control authority, every 3 years, has to go through a process of reviewing and reapproving every single one of those protocols. Bonnie, what is the 3-year review process and why do we do it?
So as you said, it is required by every MCA in the state of Michigan to review their protocols every 3 years. We do it because we do need to evolve as a system. So there's a really good reason to do it, to make them better every time. But also it's in state statute that we have to do this. And it's upon the medical control authority to do that. So we did it, started last summer and went through to about January, February, creating the protocols with a lot of our providers' input, and we sent them up to the state.
John, you're a protocols guy. Give me the mechanics of this real clearly in just a few sentences. How does the OCMCA facilitate this process and go to the state?
The process was given to the Protocols Committee. Protocols Committee reviewed each and every protocol, cross-referenced any reference to other protocols, and made sure that they were consistent across all protocols using the same language and the same verbiage, because at 3:00 in the morning, we didn't want providers arguing over which protocol should I follow. This one says this, and this one says this, and it's treating the same patient.
So what I'm getting is that over time, science changes and evolves and may need us to change some of our tactics of how we treat our patients or even assess them. And then other things are maybe a list of items that we've identified over the years of, hey, these references to other protocols, how they're numbered, how they're structured, the size of the font, the size of this and that. Cleaning them up is absolutely necessary. And at a 3-year review process, it gives us a timeline benchmark, put it on the calendar, get it done so that we can, like Bonnie said, evolve in a very objective manner.
Yeah. And so what you have is sometimes you have a protocol that you want to make a change to, and you unwittingly make it not match another protocol that you didn't even know was referenced that protocol that you changed. And that whole process is to clean all of those things up, the things you were indicating and inadvertent errors made during the change process prior to 3 years.
And also, we've been hearing from our providers through our roadshow that some things don't make sense. And sometimes we explain it and go, nope, that doesn't make sense. We're going to make that change. So it is really a system approach. It's not just a protocols committee approach. It is a system approach to creating our protocols.
So it's a mechanism to assure that we keep it moving down the road. And it's a process. So give us an update regarding this process status.
After it goes to protocols, then it goes through the entire system. And the entire system reviews the protocol changes, approves them, and then they go up to the quality assurance task force.
So when you say our entire system, you mean all of the other various committees in the order all the way through to PSRO, board of directors, basically signifying that these protocols, we all agree as a team, Oakland County Medical Patrol, its hospitals, the EMS agency says this is what we want standard of care. And then we send it to the state, and the group that reviews it is the Quality Assurance Task Force, or the QATF. And then they review it and say yes or no.
And also the state also has the final say. Does this get approved or not?
Dr. McGraw, this process is not excluding our EMS Medical Director or physicians. This is not more of a mechanics and litigious. This is about patient care. So Dr. McGraw, can you give us an update on how the process is going at the state level and updating our protocols for patient care?
Yeah, sure, Geoff. This is really, I think, a wonderful way of a system as the science changes to change with it and to make certain we're doing the best we can for the people to whom we provide care. You correctly point out when we say it goes through our process, that includes the physicians committee, the medical control board, our board of directors. And when they actually go to the QA task force, I joined Bonnie and John when we're questioned about the changes that we've been made. Because candidly, sometimes at the state, they will say, we really like this change. We love this change so much, we'll even put it in a state protocol. Or they might say, this change doesn't seem like you need to make it. Tell us more about that. So we're there to sort of provide background. Maybe it's partly due to the geography or the hospital availability in Oakland County, or maybe our appreciation of the new way of doing things is not entirely shared by the QATF or its physicians. That's the thing about medicine. really have to take the great overlook of the best intended medical minds to provide sort of final analysis of whether or not something should be implemented to a community. It doesn't mean we'll always agree, but I think there's a lot of really great compromise that occurs when we are, as a system, presenting our best ideas to the state, and the state says yes, no, or tell us more about that. I think that's a really good check and balance to make certain that there isn't some harebrained medical director somewhere, hopefully not me, putting things into the protocols that makes no medical sense or isn't consistent with current medical practice. That's the kind of check and balance which protects ultimately our public. And we should be grateful that even though it's a little bit like watching sausage get made and it's a little cumbersome, along the way, you hope that that group of good, well-intended minds is coming out the other end with the best indicated protocols for our communities.
Absolutely. As all these protocols are being approved, eventually they're going to have to be implemented. I'm guessing they're not just going to be dropped on all 3,000 providers at once. What can EMS providers expect as these new protocols are implemented over the next year?
We will be creating education for each protocol if necessary. Some protocols didn't get changed very much, so it might just be a crosswalk that you'll see. Others will have more education to go with them so that every provider in Oakland County understands what the expectation is in the protocol for our providers.
I know John and I have had a lot of discussions on how we're going to make it as simple as possible for every single EMS agency coordinator or provider to understand what changes were made and then access information on how to learn about that protocol. So we're doing everything we can to make it clear and efficient.